Yeah, so I think that the advantage of this tool is that it can be automatically deployed at health institutions, and so I think our hope would be that patients that sort of meet those initial risk features, older patients with heart failure, increased wall thickness, that this model could be run automatically on their echoes and basically generate a real-time prediction on the presence of amyloid. And that patients that are considered positive by this model could then be streamlined for downstream testing and diagnosis and therapy. And we hope that the deployment of a model like this could help to broaden the detection of it, particularly at health centers that have less capabilities, or in community or rural settings where there's less awareness for cardiac amyloid, that this tool could help to sort of democratize the diagnosis and access to therapies. Yeah, well, I think that there has been an influx of many AI tools that have been shown the potential to improve clinical practice in echocardiography, but I think implementation is the biggest barrier. For one, there's medical images and the potential for loss of confidentiality, and so there's a lot of logistics that need to be approved at every institution to ensure that the image sharing is safe, and that the images remain de-identified. And so that's part of it. And then additionally, the reimbursement model is, I think, something that needs to be clarified too. Typically, the way that these have been reimbursed is through patient diagnosis. So when you have a patient who's detected by the algorithm, there's payment from the insurance companies to pick up these patients. But that's something that I think is it's a new area, and something that we need to sort of see how it works as it sort of gets deployed in clinical practice. It's critical. I mean, when we deploy these models, we deploy them, potentially across the world. And, one of the limitations of one of the concerns is that if you only validate a study like this in a specific population or a specific demographic group, it's not clear. You don't know whether it can be generalized to the entire population. And so we felt that was really, really important. And that's why we created the multi-ethnic data set, utilizing kind of a global population that had a high population of different socio-ethnic demographic groups, to ensure that this model could be deployed. Now, this is, it's important to understand this is a retrospective study, and we still need to understand how this works in clinical practice, in the real world, particularly as our understanding of amyloid evolves and patients are getting diagnosed earlier. Yeah, I mean, we're already seeing that this combination of improved awareness and access to therapies has improved survival significantly for patients with cardiac amyloid. And I think that AI has the potential to really supercharge that kind of symbiotic relationship between diagnosis and therapy. I think we can augment the detection, particularly in areas where there's less access to diagnosis. So potentially places in the rural or in community settings, this could be leveraged to really broaden our detection of this disease and then streamline them to places where they can receive treatment.